Hi, good morning.
Good morning.
I'm Dr. Joseph Leong. This is my name card. Yeah, I'm consultant in charge of the job club.
Okay.
How do you want us to address you today?
You can call me Ahmad.
Oh, Ahmad.
Ahmad.
Nice to meet
You
you.
call me Ahmad.
Okay.
Easy to remember.
Yeah,
Call
Ahmad
me
sounds like one of my friends in school.
Oh, okay.
Yeah, Ahmad, how can we help you today?
Actually, I'm very upset over what's happening here.
Oh, okay.
Because when I have this problem of medication, I have a lot of side effects. But the doctors here don't seem to be listening to me. I told them to cancel the medication. They told me, no, you should be okay, but it's affecting my work, and I'm very upset over what's happening. I actually want to stop my treatment. Is it possible for me to do that?
I see. Help me understand more. How is it affecting your work?
See, I'm working as a security guard.
Mm-hmm.
And when I start work, usually around 7,
Okay.
it's okay. But when, like around 8 to 9 a.m., I feel very sleepy, I feel very sleepy, especially after 1 week after the injection. And but after that, it's okay, but I feel quite upset over it. I don't know whether it's helping me at all. Okay. Yes.
I can hear that you are very frustrated because the doctor's not changing or not listening to you or changing the medicine.
Yes, obviously.
Could I find out from you the medication-wise, you clarify that is 1 week after the injection you're actually having this side effect that you mentioned?
It's roughly about a week or so.
A week or so?
I have this
okay,
effects,
let me just check the records. You are on IM Fluenzor 60 milligrams every 6 weeks.
That's right.
Okay, yeah, then I agree with you that that could be a high dose that may cause your stiffness.
Can I reduce the medication or just stop completely? Because I'm taking my oral medication very well.
Sure.
And I think this injection is the cause of my side effect, causing me to be drowsy, and it's affecting my work,
Okay.
And I've been to various jobs. I don't want to lose my job. Okay. It's very important.
Tell me more about your job. Yeah.
I'm working as a security guard.
Yes.
Yeah. The supervisor told me that because of my good work, they're going to promote me. That will take some time because I've not taken any MCs.
Wow,
I actually enjoy my work. Yeah, enjoy my work very much. It's quite an easy job because some people find it very like long hours. It is long hours. I work basically from 7 a.m. to 7, but I enjoy the job. I don't
that's
know
really long hours, huh?
Yeah,
you're enjoying it. Huh?
Yes. So my typical day would be I usually wake up at 6 a.m. Then I go off to work and probably reach work around 7 a.m.
Okay.
And I will take over from my colleague who's doing the night shift.
I see.
And then I will do a bit of rounds, and then usually when I'm working in a condo.
Okay, at the condo.
Security guard. Usually between 8 and 9, I feel this sleepiness and drowsiness and it's affecting me. But I managed to overcome it so far.
How do you overcome the sleepiness in the morning at 8 or 9 o'clock?
What I did was I drink coffee.
Oh, okay. That's one method, huh?
Yeah,
Drinking coffee.
I drink coffee. And sometimes I just go and have a chat with another of my colleague, Then,
okay.
Yeah, and then
talking to somebody also is another.
Yeah, that works. At least I'm not alone. Like if I'm sitting down and looking at the files and whatever we have, I feel very sleepy.
Okay. So you walking around also helps you stay awake.
Yeah.
I also saw that your medication, one is actually scopramazine in the morning. That could be causing your sedation, meaning your sleepiness in the morning.
Actually, to be frank with you, Dr. Leong, my morning dose I actually didn't take, So I don't know, so far when I didn't take the medicine, I feel better, but I'm taking the night medication. I don't know when I tried not to, I said maybe because of the medication in the morning that's causing me to be drowsy. So I said, why don't I stop? So I did that, and then it works fine with me. But I'm still taking the night dose.
I see. So it looks like you really know about your medication and also the dosing also.
Yeah, I know very well, but the doctor's not listening to me. I still want to ask him can you off the depot injection?
Okay.
Yeah, I told them many times, and they keep on saying, "It's okay, don't worry. The drowsiness will go off and all that."
Sure. I hear you. I hear that you said that the injection may be causing your drowsiness and all that. No? Typically, this injection doesn't cause drowsiness, right? It may cause some stiffness or slowness or even shakes. Do you actually have that 1 week after your injection?
The shakes, I have a bit of tremors, but
Okay.
it's okay. It's not that bad.
I see.
It's the sleepiness.
I see.
The sleepiness.
Yeah, I can see that the doctors, we have given you Benzaxor 2 milligrams
Yeah,
3
yeah.
times a day.
Yeah.
It's meant for the handshakes and all
I've
that.
been
huh?
taking that. I mean, Benzazole, I take it like every time when I feel like shaking, I'll just take it.
Okay,
Yeah, but the CPZ, I didn't take.
I see. So I
Yeah.
hear that you find the Benzaxor useful and it helps you control the stiffness and the shakes.
Yeah, it helps
so
me.
medicine does help.
Yes.
But on the other hand, the coprimazine, the CPZ, actually causes drowsiness, especially in the morning.
Yeah,
Okay.
I think
So I agree with you. Maybe
Because it's,
the morning CPZ, the coprimazine, you may not want to take. But if ever you could not sleep, for example, you could not sleep, would the coprimazine be useful for you in that situation?
So far, I have no problem with sleeping
Very good.
because I'm quite dead tired when I finish because the
I see.
whole shift really, drank my
see.
whole energy is 12 hours, and I usually sleep quite early.
Okay. So I hear that you have no problem sleeping, and also see that you're on diazepam, a sleeping pill, 10 milligrams.
Initially, I couldn't sleep when
Okay.
but then after that, I think after about sometimes when I can't sleep, then I take the medication. But I find that I was able to sleep for quite a while, so I didn't take the medication,
Wow,
the sleeping
wonderful.
medicine, because I was so
Wonderful.
tired, too tired to.
Wonderful. So actually, I hear that you said that the medicine actually helps you also to sleep, lah.
Yes, it does.
Currently, you don't need the diazepam. Is it all right with you? I take off the diazepam. Right?
Okay,
Uh,
but
and
if I
then-
can't sleep, I can come back and.
Yes, you can ask me. The other medicine that's useful to help you sleep is the coprimazine.
Promazine, okay.
Right, it's an actual additional benefit. Other than helping you sleep better, it actually reduces the disturbance. Could I find out, last time when you stopped treatment, what happened? Did the disturbance come back?
Actually, come to think of it, I did try to stop medication for a while.
Oh, okay.
Yeah, but looking back, I think I regretted because it seems like the voices keeps coming back, and I have this thinking about this conspiracy that the government is trying to have something against me and all that. Suddenly this feeling like thought comes again. So I was quite worried. So I quickly went get an appointment to see the doctor here again.
Wow.
Yeah.
I hear that it can be quite scary, isn't it?
It is very scary.
Yeah, that there's a conspiracy and then there's voices come in. Does
Yes.
it attack you, or how does it affect you?
I feel that the government is against me.
Okay.
Like everybody is even coming to see doctor is something to link with the government. The government is
Okay.
related to my appointment here.
Okay.
This is quite scary. I feel very scared sometimes
Wow.
when these thoughts coming in.
Okay.
Yeah.
So we
But,
hope that will not happen again.
Okay.
Yeah. So when it's very bad, were you able to work when you are having all those voices and the conspiracy affecting you?
When it was very bad, I couldn't work. I had to tell my supervisor that I want to take a day off, something like that. I want to rest. Yeah. There's a time when I didn't take my medication. I actually regretted not taking the medication at all because it's a bad experience for me, and I really learned not to do that again. And I find the medication is helping me, but only thing is that is the drowsiness part.
I see.
Yeah.
Okay. Thank you for sharing with me honestly actually what has happened. It must have been quite terrifying and frightening when the disturbance come, and then you're
It's
not able
frightening,
to.
doctor. It's frightening. I think you have not experienced it before.
Yeah.
Because you all are doctors. We all are patients. We feel it, doctor. But we tell the doctor, but the doctor don't want to listen to us.
Yes.
But I think when I see you, seems you are more concerned about what's happening to me.
And you're right, Mr. Ahmad. We have actually heard about many patients share with us how terrifying sometimes the symptoms can be. And from the doctor's point, we actually hope to help you, giving you medication to stay in control.
Okay.
Giving you medicine to stay in control. I think it's very important to stay in control. Okay?
Okay.
Yeah, is that important to you?
Yes, definitely it's important because when I'm in control, I can do my work.
I see. So you can do your work.
Yeah, and work is very important to
Okay.
me, you know.
Okay.
If I don't have a job, who's going to look after me? Because I'm staying with my mother who's really old, but she's still working.
I see.
And then the other siblings are all married. So basically, I need to also to look after myself.
I see.
And I can also look after my mother. When she's not able to work, then I'm working.
I see.
At least I can look after her.
Okay. I
Yeah.
hear what you're saying, that work is very important to you.
It is.
And it's also you can stay in control. And also it's because your mother also, you hope to look after your mother.
Yes, yes.
Yeah, I think that's very important to you.
Yes, yes. She looked after me when I was young until now. When I was sick, she sent me to hospital. But the other siblings also, they are concerned. But now nobody really care about me than my mother. So
Yes.
I have to really look after her when she's old.
Yeah, I'm actually very happy to hear that you are staying with your mother and you have a good relationship with your mother. She cares for you, and
Yes.
likewise you also care for her.
Yes, yeah,
I
I
think that's wonderful.
Yeah. Some of my father has passed on
I see.
many years.
Okay.
So basically, I'm the head of the family.
I
Something
see.
like that now.
Okay.
Yeah, because the other siblings, they're all married, and they do come and call us once in a while, but it's not really that close as I'm with my mother, and I'm single now. I'm single. I'm not married. I don't know when I ever get married, That maybe, I don't know, maybe I'm more stable, but I don't have a girlfriend now. I don't have a girlfriend because my job is 12-hour shifts. How to make? I go
Yeah.
back home, I sleep. Tomorrow morning, go to work, take medication, So, but it's okay. I'm okay. I'm okay.
Okay.
Yeah, I'm happy with what's happening and with life,
Yeah. I hear that you really value your family, where you're actually head of the family right now, and you're looking after your mother.
Yes.
And you want to continue to stay in control in order to work.
Yes,
So
yes.
could you just check on the scale of 0 to 10, 0 being not important at all, 10 being very important, how would keeping your job be on a scale of 0 to 10? Would it be very important, or is it not important?
As I mentioned just now,
Okay.
it's very important. So I put the scale, I think maybe 9 or 10. Maybe
9 or 10,
even 10.
Okay.
Even 10 because it's very important. I need
Okay.
to hold a job.
I see, that's
So
very
that's why
important.
when this side effects is causing me a lot of problem, it worries me because if I'm sleepy at work and the supervisor comes and see me
Yes.
sleeping at a
Yes.
job, and my supervisor, they can be understanding, but if there's too many complaints, the fellow would just tell me, Mr. Ahmad, I think you don't need to come tomorrow. That happens to a few of my colleagues,
Okay.
They were found sleeping on the job in the daytime, Not night duty, in the daytime they were sitting down and snoring. I don't know what they're doing, but I don't want that to happen. That's why the job is important to me, and I like my job.
I see.
Yes.
I hear that you put 9 and 10 on the job is
Correct.
very important.
Yes.
And what about controlling symptoms on the scale of 0 to 10?
Yeah.
Right. Where would you want to actually control and stay on top of things?
That one I do not know. I'm really quite, I don't know. It's like, I want to stop, but if I stop, I'm afraid of relapse. I mean, if I relapse and then I'll be hospitalized and I'll be out of job, maybe I have to go into hospital again. And I mean, I'm not really, concerned about want to stopping the medicine. It's like, I don't know. Maybe it's like yes or no. Should I stop the medication?
I see.
I've done. I tried not taking the. So far, it works well for me.
Okay.
Like not taking the CPZ in the morning.
Sure.
Yeah.
Sure.
So far, I'm okay.
Okay.
But,
So I hear you that in terms of confidence, right? You're not so confident whether you can stop totally.
Yes.
Because on the one hand, you want to stay in control of your symptoms.
Yes.
You don't want the disturbance to come back.
Correct.
You want to stay in control so it can continue to work. Is that
Yes.
actually what you want?
Yes. Yes.
Okay.
Yeah.
Okay. Ahmad, how confident are you actually in staying in control? on a scale of 0 to 10, 0 being not confident at all, 10 being very confident?
This one, I think I would rate that around 5.
Around 5.
Yeah, I don't know. I'm not sure whether I have to stop or not. So I think it's about somewhere there, 5.
Okay. Why
Yes.
5 and not 3? You're not confident.
I think 5 is okay because if 3, I'm less confident. But 5, I think if I stop the medicine, I'm still okay. I'm still alright. I mean, I'm still okay if I don't take the medicine in the morning. You see?
I see.
Yeah. So I don't think it's 3. It's more 5.
Okay. So without taking the medicine is in the morning, you're still okay.
I'm
so
still
you're
okay.
5.
Yes.
Then why 5 and not 7? Why not more confident that you can stop the medicine?
I'm afraid of relapse.
Okay.
Because if I stop the medicine, I thought maybe I will have a lot of this thing coming back again, this conspiracy. So I don't think I will rate that high confidence on that scale.
Okay.
Yes.
Thank you for sharing with me. Then what would actually need to happen to move from a 5 to a 6?
You mean my confidence?
Yes. What would actually need to happen? Make you more confident to move from a 5 to a 6?
Of course, the medicine should be helping me.
Okay.
If
The medicine
help
will
me,
help you.
then I'll take the medication. If the medication not helping me, then I won't take.
Okay.
Like if you maybe give me a better medication, or higher dose, or maybe if it's better, then I will take the medicine definitely.
Okay.
Yeah.
Thank you for being very honest with us and sharing with us that too high dose of the medicine is not useful for you, the side effect. On the other hand, you need the medicine to stay in control.
Yes, definitely.
Yeah, I think it's so good to have a very honest discussion about the medication and how's the medicine helping you to stay in control. I'm also very happy to hear that you have actually managed to use other methods to keep yourself awake and not so sleepy.
Yeah.
One you told me was that you actually take a coffee, right, in the morning.
Yeah.
That helps you.
Yeah.
And if you feel sleepy in the morning, you can go and talk to a colleague.
Correct.
And that helps you also.
Correct.
And the last one, I think you mentioned that you walk around for the security.
Yes.
And that really helps you and energizes you.
That's right.
Okay.
That's right.
And I'm also very happy that you are honest with us and you tell us that you have actually stopped the copromazine in the morning. And I agree with you, that one may have caused you sleepiness in the morning.
Yes.
So the suggestion is that you may want to take it at night, right? Because that can really help you sleep. Okay. I hear that you have no problem sleeping currently.
No
So
problem.
I would like to actually take away the sleeping pill, the diazepam. Okay. In the event that you can't sleep, you can always take the copromazine at night. Okay. Take more of that, and then that can help you sleep and stay in control.
Okay.
The next thing I'm looking at is your injection. You mentioned whether we can stop the injection.
Yes.
I hear that sometimes there's something still disturbing you on and off.
Yes, there's still some disturbance, but not very, not that much as first time I had this episode.
Okay. I have this concern also is if I stop the injection, right, when the injection wanes off, all the medicine in the body goes off, the disturbance may become out of control. So my recommendation is maybe I will actually reduce it from 60 to 40. Is that something that you like?
Okay, then that'll be good for me.
Okay. While we are actually reducing it, I would also like to monitor your condition.
Sure.
So can I actually see you every month to see how you are?
Every month, I think should be okay because I can ask for a day off on that day.
Okay, so your
should
day
be
off.
Right. Should be okay.
Okay, very good.
Yes.
So if you're all right, I'll give you your IM Fluenzol, 40 milligrams. That's reducing from 60 to 40, from 6 weeks to 4 weeks. You come and see me every 4 weeks.
Every 4 weeks instead of 6 weeks. Okay.
We also thank you for your honesty. So we take off your diazepam. You don't need your sleeping pill anymore.
Right.
We give you your copromazine only at night.
So the copromazine still remain at 200?
Yeah. At night.
At night.
Are you okay with the medicine, 200 milligrams at night?
It's okay, I think it's okay. So far it's all right.
Usually people on a high dose may feel a bit giddy, groggy, or have some difficulty passing urine.
I see.
Do you have that issue?
I don't have that issue.
Okay. But if you take a high dose, let's say 400 or 600,
Right.
then we'll be concerned
Okay.
about side effect. Then the benzaxol is actually now 3 times a day.
Yes.
We'll still keep it first.
Okay.
Right? If you no longer have any shakes or stiffness,
Okay.
then we can actually reduce that some more.
Okay.
So today, I think I've actually listened to you.
Mm-hmm.
I hear that work is very important to you, and you put it as very important on a scale of 9 to 10,
Yes.
and that you want to stay in control. On
Definitely.
the other hand, you may not have the confidence that you can stay in control without the medicine.
Yes.
Right? So thank you for being very honest with us. And are we agreed that we can give you this treatment today?
Yeah. I thank you a lot, Dr. Leong, because before coming here, I heard a lot about you, Dr. Leong. So that's why when I came here, I said I'm in good hands because this Dr. Leong, I hear from a lot of some of my patients. I hear that Dr. Leong is a good doctor. So I said okay. So when I come to see you, I agree with them that you're a good doctor. And now because the other doctor don't listen to me, they say, oh, you just take the medicine, don't worry. But now when I see you, you're able to adjust my medication, which I'm very happy.
Yeah.
And then I'm on 40 milligram. It's a lower dose. And all that.
Yes. Yes.
Yeah, thank you, Dr. Leong.
Yeah. I wish you well, and I really wish that you can continue to continue your work and even get a promotion.
Yes,
Yeah,
I'm looking
and
for.
thank you for your confidence in us
Sure.
also.
Thank you, Dr. Leong.
Have a good day.
Okay, sure.
Thank you. I'll see you next month.